I'm Michaela. I'm a member of the Hospital Relations Committee of Illinithon, and we're here today with Dr. Batton. Can you tell us a little bit about yourself and just who you are and your role of the hospital?
Thanks for having me. Thanks for everything you guys have done for the Children's Hospital over the years. We really appreciate it. I'm the Director of Newborn Services here at the Children's Hospital, which means my role focuses primarily on the care of babies after birth before they're ready to go home. While many babies only have to be here for a couple of days, we also have hundreds of babies a year who need intensive care for one reason or another before being stable enough to go home with their parents. Most of the time, babies are admitted to the neonatal ICU because they're born early, born premature, and have some sort of problem related to that.
Can you tell us what made you want to become this position, and like where you went to college, just the whole history?
Sure. So I was born in Rockford, Illinois, while my father was a third-year medical student with the University of Illinois, so strong roots. Mm-hmm. My family grew up in central Illinois, and as a child I moved around for a number of years, but eventually in 2008, a decade ago, when I was looking for a permanent job, I came back to the central Illinois region. I got into the care of premature babies, into neonatal intensive care, because I wanted to help a population of infants, a population of patients that couldn't help themselves. And it's been very rewarding. It's been a great job, great decision that I've never looked back on, and I really enjoy my work.
What made you choose St. John's to work at over other hospitals?
Lots of things. The scope of services provided at St. John's, the fact that St. John's has the only neonatal ICU in the area, the fact that many of our patients come from an hour or 2 hours away to get care, and if St. John's Children's Hospital didn't exist, they'd really, find themselves in a difficult spot, difficult finding a place to get care for their babies. I think those were the main reasons.
So can you tell us about like a typical day?
So a typical day in the NICU is we, as a group of doctors, nurses, practitioners, therapists, will spend the morning going bed to bed, rounding on each patient, talking about how things went overnight and coming up with our plan of care for the day, doing the necessary paperwork and orders related to that, communicating with families. And the remainder of the time is spent preparing patients for discharge, communicating with families, admitting new patients to the neonatal ICU, and we have on average a couple of those a day and a couple of patients a day going home. An average day in the NICU means we see about 37, 38 babies, and sometimes it's a little bit less than that, sometimes it's many more than that. It just kind of varies. The NICU, we like to say, is predictably unpredictable, so in some ways there really isn't an average day.
Do you have a favorite moment that has happened?
I have many favorite moments. Because of my job, I get to see things that many people would describe as miracles on a regular basis. I think the times where I enjoy my job the best are when I see babies that I took care of in the past come back when they're 3, 4, 5 years old, and they're doing well, and they're healthy, and the families are grateful for what we were able to do for them. That happened about 5 minutes ago, and it was a really wonderful experience. Seeing what happens to our babies down the road is an important part of our job, and seeing those great positive outcomes is a big part of what keeps us motivated to keep doing what we do.
How has the donations from CMN helped you in your line of work?
So there's a great need for medical technology and appropriate facilities, particularly when it comes to the care of premature babies. Babies' brains are developing at a higher rate than at any other time in life, and there's no other time in life where the environment in which the person exists has a greater impact on how the brain develops than in babies. So some examples of how the CMN has directly impacted the environment that we're able to care for our babies is through the purchase of what we call kangaroo chairs, these reclining chairs that allow our mothers to hold babies skin to skin, even babies born months early, babies on ventilators. And infant maternal bonding is just a hugely important part of what we do, and has hugely important positive health benefits on our patients. We redesigned a room a couple years ago called the support room, again with funds from the Children's Miracle Network. It's a homegoing room where parents can spend the night with their baby and sort of better learn how to care for him or her just prior to going home. And perhaps most importantly, we're in the early part of redesigning the entire neonatal ICU to make it a more private, family-oriented environment, and the Children's Miracle Network has played an important role in that process as well.
Well, that's all that we have for you today. Thank you for taking time out and answering our questions.
Thanks for having me. Glad to be here.